Next, I would like to invite Mr. Vipin K. Chandran, Senior Vice President and Head of Healthcare Vertical at Impulses Private Limited, to hear his views about the role of technology in healthcare. Over to you, sir.
Thank you. Good afternoon, everybody. I think this is very worst timing to talk because I think after lunch, everybody has maybe even if you try not to sleep, I'm sure um, you will be sleeping. You can't resist the insulin spike and the glycemic crash or whatever it is, right? Um, so I'm here to talk about impulses. So we are one of the sponsors of this event, and we've been associated with NASCOM for quite some time. And so today, in two parts, we are talking about our view about AI, and then second part, we are talking about what we are doing in AI. So that's how we will go about it. So we want to start with the main thing about the fear of AI, right? I think in the couple of discussions we had here, I also heard people talking about, oh, AI is going to take over, or AI completely will take over everything, and then there won't be any. I mean, you lose your job and stuff like that. So there are many uh, surveys done by many organizations. So this is from some of those where the doctors fear that the doctors fear that the AI will erode their judgment, and they also feel that the payers it will serve the payers and not the patients. So that's another thing that doctors felt, and you can see that still 58% worry about the overall reliance on AI, and how it is going to impact them. And if you look at the ASHA workers, I think there are a million ASHA workers in India, and it covers 800 million plus rural patients, and they don't have access to health. I mean, they don't have access to the doctors. Many of the thing they do themselves, and they in the survey they felt that they may be left behind in this AI revolution. But I think we see a lot of things happening there with Microsoft coming up with the Asha bot, which is a WhatsApp-based system for connecting ChatGPT, and then letting them take the answer the questions they have. And the nurses, that's a high number. 76.8 percentage fear displacement. They feel that they may lose their job. It's another survey that happened. And the radiology side is the biggest fear. I think a lot of we had here a couple of startups talking about radiology as well. So there's a big feeling that the radiology specialists are going to lose their job and stuff like that. So, and then the medical coding is another area that is going to be impacted. People who kind of convert doctors' notes to codes like ICD and stuff like that. And hospital administrators, for example, they 75 percentage of them don't know who will be liable for AI errors. That's one survey that we found. And the patients, I mean, 3 in 4 patients worldwide don't trust in AI because they think humans should be involved. And that percentage is 37 percentages in India, and which is actually down from it was 52 and it is 42 percentage in 1 year. So this is where we are, and the fear is real. The survey, it is survey backed. It's present in every room talking about AI, not just in healthcare. I mean, you're talking here healthcare, but if you go to engineering, if you go to any place where AI is making a move, people feel that they are going to lose their job. So the concern is legitimate. Some roles will evolve, some will transform to something else, but mostly what we feel it, the role is going to most of the role is going to become more valuable. That's what we feel. So we wanted to see talk about why no one should fear AI. So it actually solves AI is basically it solves the problem of scale and pattern, right? It's not going to do a direct judgment, or it is not going to have an empathy or the doctor patient relationship. So, and evidence actually shows the augmentation effect of AI. So if you look at the radiologist study that was done in US many years back, they actually radiologists are actually becoming more productive, and they are catching more errors. So I mean, they're catching more anomalies and diseases. In fact, and nurses are able to intervene earlier, and then physicians are able to prescribe safer medicine, right? And then the real risk, what we feel, is not adopting it AI. What we feel is if you are left behind, uh, we are like making more patients suffer. So that's what we feel. So AI, I always say AI is like the opposite of marriage. So marriage is something you were outside, you feel that everything is good, hanky dory, and then once you get in, you know what happens, right? But AI is the opposite, I feel, because when you are outside, you fear that, oh, this is going to kill me, this is going to take my job and everything. But then the moment you start embracing it, I think you will start feeling how it is making you better, making the treatment better, and so on and so forth. So we wanted to take a different stab at it. So why, what does AI do in healthcare? So what uh, I'm trying to talk here is it does the part that human biology was never designed to do. That's what we see the patterns of AI doing good. So we'll take some examples. So the CNN, which is convolutional neural networks, this is a deep learning um, framework used for medical imaging. So if you see that the gap is that in the human eye has something called a fovea, which is the middle part of the eye, which makes you see only 2 degrees of uh, what is in front of you, right? You only concentrate on that. You don't see anything outside. So you, that makes you scan through a, if it is a radiology report, you need to scan through that whole thing to understand it. So that actually makes us worse, biologically worse, for doing these kind of things, right? So if you have a radiologist who has to go through it, or a doctor, and if you are doing 100 scans a day, it makes you tired of it also. But if you look at a CNN, it is actually built for doing this parallelly, and it goes through every pixel. It is not going to miss anything. So that way, the detection of anomalies and issues in a radiology is much safer. So if you see the results, AI is actually 94 percentage accurate than a radiologist. Radiologist is 65 percentage, and AI does 44 percentage better. And there are many examples of that, many use cases of this particular gap. And then talking about another technology within AI, which is vector embedding. This is it is used in diagnosis and drug safety. So the gap is a clinician in their life, they may do roughly 5,000 to let's say 15,000 unique patients in their career. But then the rare disease, an example, the rare disease may not be in that 15,000 unique cases they will be going through. So basically, that it is not possible for a clinician to kind of remember, if somebody is coming in front of him, to remember what happened to another person in another play. And even in his career, he may not be able to remember that. So, but the technology used in LLMs, the vector embedding, is actually able to look at any number of, it can kind of refer back to thousands and 10,000 vectors. And then, it can kind of match what is in front of him, and from maybe a millions of records that is in the database. and it can say, okay, you know what, from this 5 million, 10 million cases, there are two cases that are similar, and why don't you refer to it and then decide on your treatment. So that's possible with the technology. That is how it is built. So, and the human brain is not built for that. The technology is built like that. So we should ideally use it to make sure we are treating people well. So there are some use cases, as I already spoke. And then transformers, which is GPT, which generates the the chat GPT and cloud, everything is based on transformers. And the real gap again for humans are, they are working memory holds only 7 items plus or minus. This is actually a famous law by a psychiatrist called Miller's. So beyond that, you can't even remember. But then the transformers are designed to kind of refer back thousands of tokens, and then making sure what it is going to generate is accurate, referring to everything in the past, right? So that technology is built for that. So we are not built for that. We can't keep so much thing in our memory. The AI is built for that, right? So that actually makes AI much more better in such use cases. And then there are other cases of streaming AI. If a nurse is doing continuous patient monitoring, the multitasking is something we can't do. The nurses cannot look at multiple patient monitors, and she don't know what is happening there. And there are risks of people dying with cardiac arrest or even sepsis. And you don't really able to see that happening, because it can happen over 4 to 8 hours, and you don't know what we can predict that from a human point of view. But then the streaming AI, it can watch every patient every time, and what data is coming to the AI model, and it can compare with the patterns and decide like what is going to happen to that patient. And it can tell the nurse that this patient may develop something, and you can go back and look at that particular patient. So, and then this is another important side of what LLMs can help at the point of care. So it is a combination of LLMs and RAG, which is retrieval augmented generation, and ICKO, which is a new term, which is nothing but interoperable computable knowledge object, which is converting your knowledge or your clinical guidelines or a recommendation into a computable knowledge object, so that we can feed that into AI, and it will never make a mistake, or it will not hallucinate in front of the patient. So that's something. Impulses as a company, we are working very closely with a couple of our customers, like the American Heart Association and Walters Kluwer, to build this for their one of. I mean, Walters Kluwer has an existing point of care solution, but we are making it interoperable. And for AHA, American Heart, we are actually building that solution now. So basically, there is a study done in 2024 that said that every primary care doctor would need to read 29 hours of medical literature to be ready and to be stay current with the new guidelines that are going to come up. So the LLM, RAG, ICQ actually fix that problem. It can actually connect with the knowledge base, which keeps updated every time, and then it will give them the right information, the relevant information at the point of care. So that's another use case. So basically, this is the landscape, and we feel that the AI is going to transform. It is already transforming, and it is the right technology where a lot of the things which we are not good at humans, AI is going to help us to become smarter and better. So we feel it must be something we should embrace. We should not look at it from outside and then fear about it. I think we should go and start studying and understand it, and then it is going to help you. So let me show what we at Impulses are building in this space. So Impulses is a 24 plus, we are 25 this year, years in business, 1200 plus employees. We have like 300 clients, and then we have a partner. Our portfolio is huge. We have subsidiaries like Medline, who is into is a healthcare L&D platform. Delta Think, we recently acquired, is a US based strategy and a consulting firm. And Zero Kelvin is basically a healthcare HRMS platform. So, so we talk about impulses, and I'm specifically talking about what we do in healthcare. So we have a huge footprint in the healthcare research organization side. As I mentioned, American Heart Association is one of our biggest customers for 13 plus years. And you also see the American Academy of Association of Pediatricians, so that they are also our customers. And there are many like Diabetes Association and stuff, which I am not mentioning here, but we work with them with AHA. For example, we run their disease registries. We have their guideline training, the CE credits, the ICQ, which I just talked about. So we have big footprint there, and then we are also have many customers in the medical device manufacturing space. So Laerdal Medical is one of them. They are one of the biggest or largest medical mannequin manufacturers in the world. If you have in your hospitals, if you do a lab, if you do CPR training, I'm sure 90% of time that mannequin is going to be from Laerdal. So we run their tech. We have established their GCC in Bangalore. We've been running it for many years, and we do testing as a service for them. We do engineering, and BPL Medical Technologies is a name which you will be familiar from BPL. So we have them as our client. We working with them on many good new technologies, which I will be talking about. And then we have good presence, deep presence in the payer side in the US. And we partner with Onyx Health. Onyx is one of the leaders in that space. And we have 50 plus payers and 25 plus Medicaid providers as a client list in the US. And then in hospital and provider side in the US, so we work with AHA to, as I mentioned, there is a disease registry, and we also work with them for professional certification, certifying professionals with AHA standards. And we also run the quality, clinical quality consulting, where we go to hospital and help them to upgrade their standards, clinical care standards to AHA standards, and then certify them for getting accredited by the American Heart Association. So that's another thing we do. So this is from a global footprint point of view. And I also want to talk about what we are doing in India. So the India hospital segment, we already have a big presence with Medland as one of our subsidiaries. So they are a hospital talent management platform, and there are 350 plus hospitals. I mentioned a few here in our healthcare client list or network. And then additionally, we run a registry called QBox. So it's a clinical registry. It is used for collecting data from multiple sources, and then use it for maybe finding quality insights, or even you can use for compliance reporting as well. So QBox is a major platform or a product we run, and AHA uses many hospitals in the US uses it. And then BPL, we work with BPL on connected care. It is BPL is actually betting big on the connected care. So they do remote monitoring, connected ICU, OT, etc. So that's something which we are working with BPL. And then the last, which I want to talk for the next 1.5-2 minutes, is about Care AI. It is the agentic workflow automation product which we are building right now. So I'll talk about that a bit. It's I think in one of the startup talks we heard about agentic orchestration. But what we are trying to do to become an agentic AI orchestration layer for hospitals in India. So it be it the whole patient journey is what we are envisioning, from admission to clinical notes to coding to claims to complaints and patient engagement. So what we are trying to do with our current partners is connecting with, I mean, have agents doing different things in a workflow, which I'll show what we are working on in the next slide. But we have systems to connect to EHRs, registries, and third-party APIs it can connect, like ABDM or payer APIs, and then third-party models where we have a system to kind of select the best model to do a job, and then connect that model to the system. And then we have our own homegrown agents for documentation, medical coding agent, or even a compliance agent, etc. And then, as I spoke about the clinical guidelines, ICQO, we have a knowledge base connectivity through RAG and ICQO for connecting to knowledge bases, and it can connect to external APIs, and it can connect to reporting engine, patient communication, hospital dashboard, etc. So what we are envisioning is an agentic framework which is going to connect with different agents. Some of it will be our agents, some of it may be an agent which is developed by anybody, maybe a hospital or one of the startups. So we want to become the vehicle which will take these already established agents and LLMs and softwares, and connect that into a chain of workflow which will solve real problems for hospitals. So that's what we are trying to do. And some of the use cases which we are right now doing, we are running a beta program with some of the Medline customers. It is clinical documentation is agent, and NABH compliance agent, and the post discharge follow up agent. So there are many use cases that you see is something which we are right now doing beta with some one of the customers, a few of the customers in Medline network. So that's what we are right now doing, the recent innovations which we are bringing to the company. And I mean, this, we know why hospitals must embrace AI. There is revenue leakage due to claim denials, compliance is a burden, workflow is a problem. I think we heard many people talking about this before me, and documentation is a burden for doctors, and there is a workforce shortage overall. So this is our vision, future vision of hospitals. We need to be intelligent, AI orchestrated, as much autonomous as possible, and then ready for the future, including ABDM and even interoperability ready. So that's our vision. That with that note, I will end my session. Thank you, and we are happy to be able to be sponsoring NASCOM this event. We are so happy to see a lot of startups coming here and talking about their stuff. So we are here at the booth behind, and we can talk. And thank you.
Thank you, Mr. Vipin. I request Mr. Navratan to felicitate our speaker. Mr. Navratan, sir, requesting you to come onto the stage to felicitate our speaker. Thank you. Let's give them another round of applause, everyone. Yes. Yes. With AI growing so fast, one of our key concerns lies on our data privacy, right? Where does our data go and who does it fall under? So, the next discussion is focused on data security, privacy, and governance in healthcare. As healthcare organizations increasingly adopt AI and digital technologies, protecting sensitive information remains a top priority. Moderating this session is to Mr. Gaurav Vasu, CEO Unearth Insights, along with Mr. Sudeep Dey, CIO and CISO Aster DM Healthcare, Mr. Sri Shankar Gurujalam, Head Cybersecurity, Simons Healthcares, Mr. Vivek Rajgopal, Group Chief Analytics and AI Officer at Narayana Health, and Mr. Nand Kishore Dome, CIO Manipal Hospital. Let's welcome them with a round of applause.
घर ले जाएंगे।